Okay, so I got an order for my patient to get some fluids and also to get an IVPB back of potassium. So I've gone to the MAR and I've pulled the medication. I've performed my first and second checks to make sure that I have the right medications, the right dose, and the right route. And I've also visualized the bags to make sure that they're not expired, there's no sedimentation for both the saline and the potassium. So once that is done, I will gather all my supplies and I will head into the patient's room. When I get to the patient's room, I'm going to perform hand hygiene. I'm going to verify my patient's name and date of birth. Hi, Mr. Cole. Can you tell me your first and last name and your date of birth? And I'll verify that with his band to make sure it's correct. And then I'll let him know that we're going to be hanging up your fluids to help your hydration and also give you some extra potassium because your potassium's running a little bit low. And then I would perform my third check just to make sure again that the medication and the fluids that I have are what is listed on the MAR. And then I will assess my patient's IV site. And take a look. I'm looking for any redness or swelling, asking the patient if he's had any pain in the area. I'm going to unclamp the IV and clean it. 15 seconds. Flush, checking for any resistance and drawback for blood return. Blood return's good, and then we're going to go ahead and flush with 5 mL to make sure the line is patent and open. And also, I'm observing my patient to make sure this isn't causing him any pain. Okay, I'm going to leave that connected. Then I'm going to go ahead and get my fluids ready. So I'm going to get my line and my bag. Get the spike opened up and open the bag and spike it, keeping it sterile. And get that hung. Make sure the line is closed. I'm going to go ahead and prime this line. I'm going to loosen the cap and make sure there's no air bubbles. Prime my drip chamber.
I'm like, okay, come back in for $27,000. Okay, like I'm gonna pay it tomorrow. What you gonna do? And now they're like, put liens on you. Will you? I'm like, what in the heck? Go after billionaires, people. Stupid.
Being careful not to waste fluid. Get all the air bubbles out of the line. Close it up. I'm just going to check this line again to make sure that I don't see any air bubbles. Looks good. I'm going to attach it to my patient. I'm going to go ahead and get the pump turned on. Get the line in the pump. Not a new patient, med-surg yes. I'm going to hit channel select. We're going to do guardrails, IV fluids. We're down to 9% normal saline. This is correct. The rate to be infused is 100 mLs per hour. So put that in. The volume to be infused is 500 mLs. Hit start. Make sure the line is open. And then we're going to watch the drip chamber to make sure that it is infusing. And we see the drips to confirm. Then we're going to go ahead and do the IV piggyback of the potassium. So I'm going to get my bag and my line. I'm going to go ahead and lower my primary. Make sure my line is closed. I'm going to spike my bag. Hang that. And I'm going to prime the drip chamber about halfway. And then we are going to carefully prime the line. Get out all the air bubbles. Okay. I'm going to go ahead and swab the port. Seconds. Connect it. Then we're going to go ahead and hit channel select. We're going to do secondary. And we're going to scroll down to. Oh, I'm going to hit P. Go down to potassium chloride, and it's peripheral, and we got 10 milliequals in 100 mLs. So select that. This is correct. Drug amount 10 milliequals in 100 mLs. We hit confirm, and then we're going to verify the clamp is open and hit start. Make sure that the drip is dripping. It's going in. All right, I'm gonna check with my patient and make sure he's feeling okay. Everything's going good, and let him know if he needs me, he can press his button. And then I'm going to document everything and make sure all my lines are labeled with my name and the date.